President.
The Senator from New Jersey.
Thank you, Madam President. Today is...
The Senate is in a quorum call.
I ask unanimous consent that further calling of the roll be dispensed with.
Without objection.
Thank you, Madam President. Today, June 28, 2012, 30 million American people gave thanks. And it's because the Supreme Court this morning upheld the health care law that will provide those 30 million people with access to affordable health insurance. Today is a proud day for America and for the values that we cherish, because on this day, our nation's highest court has reaffirmed that America is a country that works for everybody, not just a privileged few. We've fought for these values for many years, and this victory is just the latest in Americans' long struggle for a fairer and more equal country. We took the first step 77 years ago when President Franklin Roosevelt signed Social Security into law, ensuring that in this country no senior would go hungry. 30 years later, President Lyndon Johnson helped America take the next step when he created Medicare and Medicaid, ensuring that our seniors and the most vulnerable among us would always have access to health care. And today, our efforts to ensure that every American has access to quality health care has been given the stamp of approval by our Supreme Court. Today we establish our belief in America, the wealthiest nation on earth, that it's our moral duty to make sure that everyone can keep themselves and their families healthy. Madam President, a little more than 2 years ago, we heard the call of Americans struggling to pay for health care, parents who had to choose between keeping their children healthy and putting food on the table, and seniors who couldn't afford life-saving medications. And so we passed, and President Obama signed into law the Affordable Care Act. And already millions of Americans are reaping the benefits of this law. Thanks to health reform, insurers can no longer deny people coverage for a pre-existing condition. If someone has cancer or some other long-time sickness, they can't deny people coverage if they are already sick from these conditions. Up to 17 million children with pre-existing conditions are already benefiting from this condition, from this provision. Under the Affordable Care Act, insurance companies are prohibited from canceling coverage when people are sick. And more than 3 million people in my state, New Jersey, no longer have a lifetime limit on their health insurance coverage. Today, millions of seniors are already receiving free preventive health services and are saving an average of $600 a year on prescription drugs. It's not just seniors who are seeing lower costs. Almost 2 million New Jerseyans with private insurance now receive preventive health services at no additional cost. For women, these services include cancer screenings like pap smears and mammograms. And since the 1950s, it's amazing, cerebral cancer screenings have cut mortality rates by more than 70%. Think about that, 70% of the people who are alive now who otherwise would have died if they didn't have the coverage. Young people have benefited as well. More than 73,000 young adults in New Jersey obtained health coverage last year through their parents' insurance plans. And this has brought their parents peace of mind knowing that their children who may have just graduated from school and are making their way in the world will be covered with insurance if they need it. But, Mr. President, even with our Supreme Court's decision, our friends, the Republicans, continue to fight our efforts. They're again showing that they will stop at nothing to make seniors have to pay more for medications, more families go bankrupt, and more parents having to choose between feeding their children and taking them to the doctor. Our colleagues across the aisle keep telling us they want to repeal and replace health reform, that they simply favor other solutions. But they have no proposals and no ideas on how to do that. Instead, they just keep giving the American people the same message. Give your benefits back. We can't afford it in this rich nation of ours. Well, I have a message for them, for my friends here in this place where care is so carefully given, that if you don't want Americans, I say to colleagues here, to have affordable health coverage, then you ought to give yours back. That's what I say. The Republican hypocrisy is stunning. As members of Congress, these politicians have access, all of us, to world-class health care. But they're determined to take away the lifeline that health reform law offers to families who really need it. Let's be clear. Without this law, insurers could once again restrict benefits, cancel coverage when people get sick, and refuse care to people with pre-existing conditions. The Republicans want to return to the days when it was legal for insurers to turn away sick children, to say, sorry, you're not covered by insurance, no matter how sick you are, can't give you any help. And I say to my Republican colleagues, stop attacking America's health care. Now, the Obama health care plan. Start working with us to ensure a healthy and happy future for all of our children and grandchildren. Americans don't want to relive the health care debates with the lies about death panels and socialized medicine. The American people want us to move forward and work together to lower costs and make sure that no American gets left behind. That's what the American people deserve from us. They sent us here, in this place, for 6 years at a time. And that's the America we must believe in. That's the America we fight for. And today we're one step closer to making that America a reality. I speak for myself, Mr. President. Some years ago, I was 18 years old. I signed up to serve my country in World War II. 18 years old. It was a dark moment in our history. The war was at its height. My father was on his deathbed. He was just past 42 years of age. He had cancer, acquired like his brother and his father did, from working the mills in Paterson, New Jersey. That's what we had. My mother was a 37-year-old widow. Things were tough. Things were difficult. I had a little sister. My father died. We all grieved. I had already enlisted in the Army, and they permitted me to stay home until my father passed on. But what happened is not only did my father leave grief, but he left bills. Bills for hospitals, for pharmacists, for doctors. People shouldn't have to go through that. The coverage ought to be there that says, we'll take care of you. You're an American citizen. Be proud of that. And don't let anybody fight to take away your rights, to protect their rights. No, it's not a balance. And so, Mr. President, I yield the floor. Note the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.
Mr. President.
Senator from South Carolina.
Are we in a quorum call?
We are.
I would ask unanimous consent to terminate the quorum call and be recognized for 5 minutes to speak today about the Supreme Court's ruling.
Without objection.
Cut my phone off. Thank you, Mr. President. There's a couple of observations I'd like to make about the historic ruling by the Supreme Court today. Number one is the legislative process. Members of Congress, during the debate on Obama health care, had a very passionate, heated debate, which is part of democracy. And as I recall the debate, when people on our side suggested that this is a tax increase, that all the fines and costs associated with the health care bill would be a massive tax increase, our friends on the other side, almost to a person, said, no, this is not a tax increase. And President Obama assured the American people during the debate that the fine is not a tax. I think the reason that was so is because if we debated this bill and the only way you could pass the bill is using the power of Congress to tax under the Constitution, there would not have been 10 votes for the legislation. Nobody would wanted to have gone home and say, I just increased your taxes by billions of dollars over the next 10 years to fix health care, because I think most Americans believe our health care in this country needs to be reformed and in many ways broken and needs to be fixed. But there are very few people in this country who believe we don't tax enough, and that's the problem with health care. That's not the problem. The problem with health care is not the lack of how much we tax you, it's the lack of choices you have in the competition when it comes to purchasing health care. Many of us want to give you a chance to buy health care outside the state in which you live, which you can't do today. Many of us believe that some form of medical malpractice will lower cost. And many of us are for preventing pre-existing illnesses being used to deny you health care. I'd like to give individuals the same tax write-off as businesses have when it comes to purchasing health care. And I'm willing to help those who don't have the money to buy health care to be able to purchase health care in the private sector. I'm willing to do a lot of things, but I'm not willing to impose a massive tax increase to fix health care. And also, I don't think it's fair for people in the body during a debate on a bill to say, this is not a tax increase, vote for the bill, and wind up having to be told by the court the only way this is legal is for it to be a tax increase. So here's my challenge to every member of the Democratic Party who said this wasn't a tax increase when we debated the bill. I'm asking you now, if you did not want to increase taxes to fix health care, repeal this bill and work with me and others to find a way to fix health care without a massive tax increase. And if after the Supreme Court ruling you're still okay with the legislation, just be honest enough to go back home and say, I raised your taxes to fix health care because I thought that was the right thing to do. And let's have a debate about whether or not that's the right thing to do. I can promise you it is not the right thing to have a debate where the President of the United States and the architects of the bill assure you that you're not having a tax increase when, in fact, that's the only way this bill can stand. So I believe we all owe it to the American people to be on record. If after today's ruling you're still for this legislation, have the courage to tell the American people I'm for it, even though I had to raise your taxes to make it happen. Stand behind what you really believe. And if you really believed at the time this shouldn't be considered a tax increase and you're upset or you are worried that it has now been called a tax increase and you think that's wrong, have the courage to say, let's start over. Nobody is going to hold it against a political leader who's willing to change their mind if it makes sense. And I can't think of a better opportunity for Congress to revisit an issue than this. If there's ever a bill that needed to be revisited, it is the Obama health care bill. It needs to be revisited, and we need to start over because it was passed on a party line vote. It was passed with statements being made that this is not a tax increase when it turned out to be. So I just hope we have the wisdom and the courage to start over and sort of get this thing right. Now, the second point I'd like to make is that no one in this country has suggested that health care needs to be fixed through a massive tax increase. Let's find a better model to fix health care than hundreds of billions of dollars of new taxes. The final thought is, how do we move forward? In November of 2012, every person who voted for Obama health care, telling their constituents this is not a tax, you owe it to your constituents to go back and say, listen, the Supreme Court said this can only stand with it being a tax. I'm either okay with that or I'd like a second chance to fix it. President Obama, who's a good man and sincerely believes that health care needs to be reformed in a certain way, I agree it needs to be reformed, but not this way, owes it to the American people to correct his statement. When he assured us all this was not a tax increase, many Americans found comfort in that. I've always believed that the court could uphold this law under one theory and one theory only. I never believed that the Commerce Clause was so broad that we in Congress could compel you to buy a product you did not want. And the court today said that the Commerce Clause cannot be used in such a fashion. So the bill was sold as a power within the Commerce Clause. The court said today the Commerce Clause will not allow Congress to make the public buy a product. That's not commerce. That should make all of us feel better that there's some limits on the Commerce Clause vis-a-vis your Congress. But the court did say that when it comes to the power of the tax, the Congress's discretion is broad, and that is constitutionally true and has always been so. The Congress has the power to raise taxes to pay for a war, even though you may disagree with the war. We have it in our power to say for the public good, we're going to raise taxes to pay for a war. Congress also has the power, in my view, to say that the health care system is broken, we're going to raise taxes to fix it. I don't think that's the right answer, but I think that is within our power. And what the court said today was that the fine is really a tax. And now that we know it's really a tax, what are we going to do about it? Are we going to leave in place the largest tax increase in modern history to fix health care? Or are we going to be smart enough, wise enough, and courageous enough to start over again? I hope we're wise enough, courageous enough, and smart enough to start over, and this time do it in a way where it will truly be bipartisan. The worst possible outcome for the American people is for the Congress to pass legislation that affects 1/5 or 1/6 of the economy, telling you that this is not a tax. And at the end of the day, that's the only way the law can stand, is for it to be a tax. So I hope that between now and the election, we can have another debate about health care. And all those who stand by this product, you need to tell your constituents, I believe in this product and I'm willing to tax you in a large way to make it happen. If we had that debate to begin with, this bill would have never passed and we'd have worked together. Second chances are hard to get in life. Congress now has a second chance. Final thought about Medicaid expansion. The Congress said that we're going to expand Medicaid dramatically under this proposal to insure people not covered by Medicaid today. If you're 133% above poverty, you would be included in Medicaid. In my state, 31% of South Carolinians would be eligible for Medicaid under the Obama health care formula. That would mean an additional $1 billion of matching requirement by the state of South Carolina to get the federal money. That means that my state would have to cut education, raise taxes, or cut public safety to come up with the money to match Medicaid expansion under the Obama Health Care Act. The Supreme Court said you can't do that to the states. You cannot expand dramatically Medicaid, which will bankrupt states, and tell them if they don't agree with the expansion, they lose all the money under the current program. That's coercive. In September of last year with Senator Barrasso, I introduced legislation, the Graham-Barrasso bill, that would allow states to opt out of Obama Medicaid expansion and still receive the money they receive under the current program. That is basically what the court said we should be doing. So I hope the Republican leader will impress upon the Democratic leader to bring the bill up we introduced last September and legislatively allow states to opt out of Medicaid expansion under Obamacare if they choose to. And I guarantee you there are going to be a bunch of red and blue states opting out of Medicaid expansion under this bill because it will make them hopelessly bankrupt. And that's not the way to solve health care for the poor. That part of the bill needs to be addressed too. So, Mr. President, this is a historic ruling by the Supreme Court, but for it really to be historic in its fullest sense, Congress should take this historic opportunity to revisit health care, get this right without a massive tax increase. I yield the floor.
Clerk will call the roll.
Mr. Akaka.
Senator from Oklahoma.
Mr. President, I ask unanimous consent the quorum call and process be initiated.
Without objection.
Mr. President, first of all, let me just, my friend from South Carolina, I think articulated it very well on what happened today with the Supreme Court. I think we're going to see a lot of people, it's going to be a wake-up call for a lot of people in America. And I think it will, as he suggested, have a profound effect on the elections in November. When people realize that the courts have ruled, when people who don't have coverage realize that they're going to be penalized by $695, that's per individual, by the way, and families who do have coverage will have to pay an additional about $2,100, and the employers of America are going to be dealing with a government exchange. You know, people are going to be concerned about it, and I think what they're going to want to do is send people to Congress, both the House and the Senate, and in the White House, who are going to change this system. So I think I'll stand here on the floor and say that's what I'm predicting and see what happens. I want to just make one comment because we're waiting now. We're going to be voting shortly on a very significant bill. It's the Highway Reauthorization Bill. It's one of these things that makes me very proud because we have been trying for a year and a half to do this. When we passed the last highway reauthorization bill, that was in 2005. At that time, I was the chairman of the Environment and Public Works Committee. We passed the bill. It was, as I recall, going from memory, it was a $286.4 billion bill. It's for 5 years. Of course, that expired in 2009. Now, the problem we've had since 2009 is we've been operating on what they call extensions. And, Mr. President, one of the things that most people are not aware of is when you operate on extensions, you're operating on with the same amount of money that you're spending out of the Highway Trust Fund, you're getting about 2/3 of what you'd get if it were a reauthorization. Because, first of all, they can only do it just a very short period of time. There's not any planning, and they've all said that you lose about 30 to 33% of the amount of spending power, money that should be spent on highways and bridges and on maintenance. Well, anyway, and it's kind of funny because I happen to have been ranked as the most conservative member of this body different times, and I'm always in the top 3. And yet I consider this to be something, I've always said I may be the most conservative, but I'm a big spender in two areas. One is national defense, and one is infrastructure. And that's what this is all about. And I'm very proud that people understand. I've had occasion to talk to a lot of the new members of the conference committee over in the House, and explain to them that the conservative position, the conservative vote on this is to vote for the highway reauthorization bill that's going to be coming up to us. Hopefully it'll be here tonight. And it's going back and forth between the House and the Senate. The conferees, I believe, most of them already signed off on this bill. So it's coming up. It's been a long time in the making. I'm very excited about it. And let me also say that while I take the position that the conservative vote is to vote for the authorization bill, for the highway bill, I'm not alone in this feeling, and I would like to submit for the record a statement by the chairman of the American Conservative Union. It's an op-ed by Al Cardenas, who is the chairman of the American Conservative Union. And he presents a case, a very strong case, as to why this is the conservative position that should be taken. So I ask unanimous consent at this point in the record that I submit in the record the statement and the op-ed piece by the chairman of the American Conservative Union.
Without objection.
So I'm looking forward to having this, and we're certainly in my state of Oklahoma. The state of Oklahoma is not the only state that has bridges and road problems, and I'm looking forward to that. Another good thing that's happening today, right now we're waiting, and I feel very confident that we're going to be able to pass out of the Senate the Pilots' Bill of Rights bill, and right now we're in the process of hopefully getting that done. And when that time comes, I'd like to be recognized to talk about some of the great extensions of justice to people who have been denied that justice heretofore just because they happen to be pilots. So with that, I would yield the floor. Suggest the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.
Mr. President.
Senator from Indiana.
Mr. President, I ask unanimous consent that the quorum call be vitiated.
Without objection.
Mr. President, I come to the floor today to speak about the Supreme Court ruling on health care. Obviously, we were all glued to the television set this morning and watching this historic and momentous decision. I was deeply disappointed with the ruling. I respect the court and its work, but I was disappointed the court failed to strike down this law, as many had anticipated that they would. I was disappointed because I believe that the law has been deeply and fatally flawed from the very beginning. It became a major issue, of course, in the 2010 election as people watched in 2010 this being passed through without bipartisan support. It was procedures were worked around and violated in order to pass it through. The stories are rampant about how, against really the will, I think, of the majority of the American people, this 2,700-page monstrosity, so infamously described by the Speaker, then Speaker of the House, as something that we'll learn about after we pass it. Well, Mr. President, we've learned about it. We've had 2 years to examine this, and we've seen it, parts of it being played out with more to come. And what we've learned, I think, is that this bill is fatally flawed, that it ought to be repealed. It doesn't mean that we don't have health care issues that we should deal with, but we need to deal with this in a bipartisan way that's better explained to the American people, that's cost affordable. It's labeled the Affordable Care Act, and it's anything but affordable. At a time of deep recession, at a time of over a period of the last 2 or 3 years of a stagnant economy, this is adding a burden of regulation and taxation that is working against our coming out of this deep hole of economic distress. Americans found out what was in this bill, and it reaffirmed, I think, many of their deep concerns about going forward with a plan that tries to wrap up the entire U.S. health care system in one big ball, 2,700 pages worth of rules and regulations and taxes and impositions and mandates, and said that this is not, we want reform of our health care. We want to make it more affordable. We want to make it more accessible. But letting Washington essentially decide how to go forward with that without giving flexibility to the states and flexibility to the private sector to initiate reforms clearly was not what the American people, or at least the majority of the American people, were looking for. Despite the promises that were made about the impact of this bill by those who authored it and by the President, middle-class Americans have found that the health care law is a massive tax, and of course the court reaffirmed that today. This is not just a penalty. This is a massive tax on working Americans, and not just the rich. It's on the middle class, and it's on every American taxpayer. Even though the President is famously now on every YouTube and every station that's discussing the health care system, his quotes insisting that this is not a tax on the middle class or a tax on any Americans. Families have found out that their insurance premiums are going up, not down, as was promised by those who supported this bill and authored this bill. Seniors have found out that they may not be able to keep the insurance plan that they have and want, and could lose access to Medicare Advantage. Medicare Advantage, a program that many seniors have enrolled in and found to be successful in addressing their health care needs at a reasonable cost. Business owners found out that they would be fined $2,000 per employee if they failed to provide workers with a health care insurance plan approved by Uncle Sam. I don't know how many business owners I've talked to in Indiana in this past couple of years who basically have said, we have sat down with our employees and discussed with them how much we were able to do and still keep them as employees and not sink this company. And we have come to agreements, and different companies have different types of agreements with different types of plans based on their ability to provide that kind of coverage, accepted by both the employees and the owners of the business. And now all these are wiped out because it's determined that Washington will decide what the minimum level of the plan should be. And several business owners have told me that they simply can't run their business in this economy on the low margins, if any margins, that they're achieving, and provide that kind of increase in insurance and have to pay for that, or opt out of it and pay this fine, $2,000 per employee. Other businesses have said, you know, well, okay, there is a exemption for those of under 50 employees, and other businesses have said, guess what, I've got 47. You think I'm going to hire over 50? No way. No way am I going to push myself into the category where I have to pay a fine of $2,000 per employee if I don't comply or with the dictates out of Washington, D.C. in terms of what my plan should look like. And so what we see is a lot of hiring of temporary workers. We see a lot of hiring, payment of overtime for existing workers, but we don't see hiring. We don't see the expansion of hiring, particularly in small business, because of the so-called Affordable Care Act. Patients and doctors, and I've talked to them all over the state of Indiana, healthcare providers, insurance companies, hospital administrators, groups of doctors that are part of a group or those individual in private practice, and all the other entities that are engaged in healthcare. And to a group, they have major concerns with this. And to a group, they have opposed this Affordable Health Care Act, or so it's described. We have a dynamic medical device industry in Indiana, as they do in several states across this country. It's one of the cutting-edge, leading industries in terms of our ability to provide new products, innovative products to make people's lives healthier and safer, and to prevent a number of unintended consequences from various medical procedures. They learned, after reading this act and finding out about this act, that they were going to be subject to a tax just levied on them, a 2.3% tax on their gross receipts, levied on them because they were a pay-for this. These companies who make pacemakers, artificial joints, surgical tools, find this as something that drives them to the point where they need to think about transferring their business overseas or part of their business overseas, or not hiring the workers that they would like to hire. It is simply a tax imposed on one of our more dynamic and innovative industries that is leading in our exports, but no longer can compete under this tax with their competitors that are based overseas. Now, just because this ruling happened today, and saying that the health care law is constitutional, does not mean that it's the right policy for us to go forward. The law remains unpopular and unaffordable, and I want to state here today that I am committed to working with my colleagues to repeal the health care law and give our citizens the power and the flexibility to make their own decisions relative to their health care, and to use those innovative ideas that are out there to put a much better package together that addresses the real question of rising health care costs and access. As I've traveled our state, as I've listened to all these providers, as I've asked the question of them, if the health care law is struck down by the Supreme Court, what would you propose? Because we have a problem here. We have rising health care costs that have to be contained. And yet we have an access problem, and we have a number of other problems in terms of gaining access to coverage and payment for health care issues. What would you propose? And I've got a long list of those, and I've talked about it here on the floor. I talked about it during the campaign. I've talked about it across the state. Things I have learned from listening to the people who are on the front line doing this business every day. And there's all kinds of innovative solutions out there. There's all kinds of things that we ought to be looking at. And I know all of us are committed to going forward, those who support the repeal of the current law, going forward to bringing forward a sensible, affordable, cost-effective, quality, effective solutions to our health care issues. So what the Supreme Court essentially has done is said, Congress, it's yours. And Congress represents the people. And we need to be representative of the people. And so what we need to do now is listen to the people. And it's the people who will decide the future of health care for this country. It's the people who will decide in this coming election, I believe, the people who will decide as to whether they want ever more Washington, ever more taxing and spending, ever more deeply in debt, ever more federal mandates and regulations, or whether or not they want to approach this in a different way that can reduce spending, empower individuals, give states greater flexibility, and bring forward sensible, step-by-step, incremental, as it's affordable, tested, proven ways of addressing our rising health care costs. And so, perhaps, rightfully so, the Supreme Court has turned it back to us. And it's our responsibility now to go forward and represent all those who were not listened to when this bill was run through this Congress in a way that violated a lot of our procedures, in a way that went against, I believe, the majority will of the American people. So here we are, and now it's back on us. And we need now to stand up and take responsibility. Those who voted for it will be defending it, of course. And those who voted against it, or those of us who are here, partly because it was an issue in the 2010 campaign, are here to not just simply say we don't like what's there, but to offer also positive solutions to the problem. Mr. President, with that, I yield the floor.
Mr. President?
Senator from Rhode Island.
Well, thank you, Mr. President. Today's Supreme Court ruling that the Affordable Care Act is constitutional and is the law of the land is a victory, I believe, for Rhode Islanders and for all Americans. Families will no longer fear financial ruin if a child becomes seriously ill, or face denial of health coverage due to a child's pre-existing condition. And they will no longer have to worry that the terms of their coverage will run out as they are being treated after a major medical emergency. Indeed, tonight, Rhode Islanders and all Americans can sleep a little easier knowing that they and their children will have access to quality, affordable health care. This is the type of security we want for our children and what this law will provide. Indeed, for the first time in our history, parents can, with some confidence, trust that whatever lies ahead, their child, at least, will have access to affordable health care. We couldn't say that with any confidence years ago, even 2 years ago, when we undertook this legislative activity. And this law has already benefited many people in Rhode Island, individuals, families, and businesses. Children up to age 26 are able to remain on their parents' health insurance plan. In Rhode Island, this has benefited an estimated 9,000 young adults and their families. Over 15,000 Rhode Island seniors have saved a total of $14 million on prescription drugs since the law was enacted, an average to close to $600 annually. Seniors will continue to save on their drug costs until the existing coverage gap is closed, and will continue to have access to free preventive care like annual wellness visits and screenings. Rhode Islanders can now expect rebates if an insurance company spends too much on administrative costs and CEO bonuses instead of on their health care. For too long, health insurance companies got away with increasing premiums and decreasing coverage, which resulted in higher costs and unfair practices. Beginning in 2014, Rhode Islanders will be able to purchase health insurance on a new exchange, a single point of entry where they can evaluate the cost and coverage of health insurance options. They will indeed, for the first time for many Rhode Islanders, have a real choice about the health care that they receive, the insurance that they purchase. And according to Families USA, 97,000 Rhode Islanders will have access to tax credits to make their coverage more affordable. 1,000 more childless adults will gain coverage through the Medicaid program. Now that the court has spoken, I hope we can work on a bipartisan basis to do what we must do, and that's to create jobs and improve our economy. This health care decision was a landmark decision. But the work now, the work of all of us, should be to reinvigorate our economy so that not only can people have the confidence that they'll have health care, but they can have the further and indeed very primary confidence that they will have meaningful work. In that respect, I'm glad that Congress is poised to take action that will enable millions of students and families across the country to breathe a sigh of relief about the student loans they need to borrow for the upcoming academic year. Everyone, from every specter of the country, will tell you that the key to our future is education, higher education, that we cannot be competitive in a world economy unless we have the best educated students in this country, that we cannot be the powerful force we have been in the world unless we have education. The key is, for so many jobs today, is going on past high school into post-secondary education. And yet, we are days away, unless we act, doubling the loan interest rates we're charging on students. There's been quite a bit of stalling tactics for months. I hope that those tactics are over as the July 1st deadline approaches. I hope we are soon to take action to prevent the doubling of the subsidized Stafford loan interest rates. And I'd like to thank Leader Harry Reid for his tireless efforts to negotiate a bipartisan solution. I also want to recognize and thank three other individuals that were absolutely critical to this effort, were really leaders without equivocation, with deep conviction. That's Chairman Tom Harkin of the Health Committee, who led with vigor throughout this effort. Senator Sherrod Brown of Ohio, who has been committed to this effort, and also our colleague in the House of Representatives, Congressman Joe Courtney of Connecticut. They have been extraordinary. Last January, Congressman Courtney and I introduced legislation to permanently extend the law that makes college loans more affordable for millions of students across the country. President Obama called on Congress to address the student loan interest rate hike in his State of the Union address. Back then, many Republicans scoffed at the idea. In fact, they voted for budgets that assumed that the interest rate would double, and they did that without any apparent equivocation. But thanks to students and families across the country who raised their voices and made themselves heard, my colleagues got the message. Fixing the student loan interest rate matters. It matters a great deal. It matters to individuals trying to build a better life for themselves. It matters to parents whose dream to give their kids a chance at a better life depends on being able to afford college. And it matters to our shared economic future because the single most important investment we as a nation can make is to educate our young people. So thanks to groups like Campus Progress, USSA, the U.S. PERC, the Young Invincible, and the Rebuild the Dream Coalition that pushed this issue to the forefront where it belongs. The letters, the emails, the calls, visits, bus tours, and campus rallies made a difference. We should soon be voting, I hope, to keep this student loan rate low for another year at least. However, it's important to remember that this is only a temporary short-term fix. Now we need to develop longer-term solutions to the growing burden of student loan debt, the rising cost of college, and the need to improve higher education outcomes so that students complete their degrees and get the full benefit of their investment in education. These are tough issues, but we have to address them head-on. Our economy and our future depends on addressing these issues. It's estimated, for example, that more than 60% of the jobs will require some post-secondary education by the year 2018. In 2010, only 38% of working-age adults held a 2-year or 4-year degree. We have a very few years to go from 40% to 60%. That gap represents the challenge we have in being a competitive economic force in the world. And certainly, if we're ever going to close that gap, we've got to make sure that we don't double the interest rate on Stafford loans as a first step. But as I suggest, there are many other steps we must take. We We have to address the rising cost of college. The cost of attending college has increased by 559% since 1985. 559%, rising far faster than costs for gasoline, health care, and other consumer items. Keeping student loans affordable and interest rates low is one part of the solution. Providing more grant aid through Pell Grants and other programs is another. We need to call on institutions to do their part to keep costs in check. Yes, the college community has to rally around and has to think of innovative ways to provide excellent education at a lower cost, a more affordable cost. States have to play a role, too. When state support for higher education goes down, tuition goes up. And the crisis of so many states, real crises, difficult crises, has forced them to reduce their support for higher education. And the result, as I suggest, has been tuitions climb. And that's another burden that middle America and middle-class, middle-income families are bearing. Now, I look forward to working with my colleagues on developing a comprehensive approach to addressing the issues. And also to just say that I hope that we are on the verge of, at least for the next year, avoiding a doubling of interest rates on student loans. We've got a long way to go to ensure that every American with talent and drive and the skills has the means to go to college. This is an important first step. There are many more that we must take, and I hope we do that very quickly. With that, Mr. President, I would request unanimous consent that members of Senator Bingaman's staff, Lisa Peterkin, James Anderson, Bijan Peters, Kendra Deutschak, and Eugenia Woods be granted the privilege of the floor for the pendency of today, Thursday, June 28, 2012.
Without objection.
Thank you, Mr. President, and I would yield the floor and note the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.